Hi there. My name is Amanda McCulloch, and I'm the Volunteer Operations Director for the Data Visualization Society. Today, as part of our Viz Responsibly web series, we're talking with a colleague of mine from around the world in South Africa. Yazabuntu Soldati is the Monitoring and Evaluation Director for John Snow Incorporated South Africa, and he's currently serving as the Monitoring and Evaluation Advisor, the Senior M&E Advisor, for the VMMC and Care and Treatment programs in South Africa that work to combat and work around the spread of HIV. Yaza, it's great to have you here today and to connect with you from halfway around the world.
Hey, thank you very much for having me, Amanda. It's great to see you again.
You too.
And communicate. Thanks.
So we're going to dig in a little bit to understand some of what's happening in South Africa related to COVID-19 and how data is playing a role in the response there, not just around visualization, but really around how data is being used. And Yaza, am I right that you said you guys have been under lockdown for 49 days? Is that right?
Yes, it's about 49 days now since we're under lockdown.
How are things going in South Africa?
I think things are going okay. Initially, there was quite a lot of panic around a non-understanding of COVID-19, but I think the government has played a huge role in terms of how they've reacted and the kind of strategies they've taken in the fight against the pandemic.
That's great to hear. So can you tell us a bit about your current role and your work in the local response around COVID-19?
Okay, so my current role in M&E and COVID-19, we've sort of had to divert a bit in terms of our normal activities that we've been doing, as some of the services that we do towards HIV and AIDS prevention have been suspended until the end of the pandemic. So currently what we're busy with is that we're assisting the government in terms of community household screenings. So the current teams that we've had, the clinical teams, they've now been converted into teams that are assisting in going around the different communities and households. And they are mostly doing non-touch community screening in terms of the symptoms that people might be having, and also referring them to some of the testing facilities. So my role is sort of like organizing some information and data around the daily activities that they do so that we can report on a daily basis back to USAID, who is the funder.
Mm. Yeah, that daily and kind of real-time demand for numbers and reporting, I think, has been something that's just been the same across every single country in terms of people having a demand for information in ways that I don't recall around any other health issue. I mean, besides maybe in the JSI work around Ebola that I remember, but this pandemic's really created a unique demand for data. Do you have a sense of kind of what's been unique about the response in South Africa? What makes the response there different from maybe other parts of the world?
I think our government's response has been sort of like a proactive approach where in the fight against HIV, we've had the immediate national lockdown, which only allowed for essential services to take place. And also we've had the risk assessment strategy that the government has been implementing. That has given South Africa as a country, I think, a head start in terms of trying to contain the virus quite at an earlier stage, and also preparing the country in terms of how will we respond in terms of getting the health system ready, getting everyone prepared to go back to normal economic activities. And a lot of that has had a lot of data, scientific, and also your normal data that's informing these decisions around the lockdown and also the adjusted strategies.
So one of the questions that comes up a lot about COVID-19 is just around the uncertainty in the case counts and the case data. And some of that is rooted in testing, but some of it's also rooted in how data gets collected. And I'm curious, given that I know JSI has worked for a long time with the health information system in South Africa, how is the national health information system that was already in place before COVID-19 been an asset or been used in the response to COVID and how that data gets collected?
Okay, so I think in terms of the national health system, there are two specific systems that are playing a role. The one is the National Health Lab Service System, which is a system around our testing data. And also we've got a system that was developed by the Council of Scientific and Industrial Research, which works with the National Department of Health. So what has happened in terms of data that we've been seeing or data that's being shared regularly from the National Health Lab Service, it's integrated with both public and private information. So that's assisted the National Command Council that advises the president in terms of what steps to be taken, in terms of the coverage of testing around the country, the hotspots that are being identified. And then secondly, the CMO application that's being used mostly with the community health work screening. That system is actually assisting in terms of identifying and also mapping those hotspots areas and also informing around the data in terms of what kind of screening is happening, and for those who are seen to be having some of the symptoms and are being referred to those that are being referred and tested, how many cases are actually being picked up. So it's played quite an important role in terms of the testing, how is it dispersed according to geography in South Africa, and also in terms of the screening that's being proactively done in terms of how many cases are being referred for COVID screening.
I always love hearing the word proactive. I don't know that every country has been similar in their response. And so I think it's great that you're able to describe that local response that way. I know South Africa, if we look back at history, was one of the hardest hit countries by the HIV pandemic, and I think would guess is in kind of short-term memory for a lot of the country. Are there ways in which the response to HIV is informing what's happening right now around COVID?
Oh, yes, definitely. I think one of the main lessons that has assisted a lot, HIV and the link to TB. So in South Africa, we've actually had a lot of TB cases. So we've linked, or government have tried to link the lessons learned in terms of the efficient and also effective strategies, where they use those strategies to identify active TB cases and also household contact tracing to diagnose more TB cases. So those lessons learned from those household tracing are actually being used for COVID-19. It's the main strategy that they're using behind these household community screenings. And I think one good example that's showing good result, I think in South Africa, our cases, I think in the first 3 weeks, I think our cases, we had seen sort of like daily increases of less than 100 cases. But specifically in the Western Cape province, Cape Town, to be specific, I think there we've seen a rise. Currently, we're having close to 13,000 COVID cases in South Africa, and Cape Town alone accounts for about 56% of those cases. There, they've used specific tracing, specific TB case tracing strategies, whereby they've identified hotspots and they've actually elevated and increased specific COVID-19 testing in those cases. And they're actually picking up a lot of cases in those areas. So lessons learned from identifying TB cases and also household contact tracing, that's assisted a lot in terms of COVID-19 testing.
I think there's so much rich local knowledge around epidemiology and infectious disease and other areas in South Africa, but also some other African countries. That it's always odd to me when someone says like, what are people who you used to work with doing? I'm like, they're learning from what they've done in the past, and they're doing great work where they are right now. So I really applaud you for kind of being able to pivot and shift over to trying to take all these lessons and systems and apply them to a brand new disease. I'm curious, I know when you and I worked together, I mean, a few years back, the focus was on building out dashboards around PEPFAR and HIV data. I'm curious if you've seen or had any charts or graphs, simple or complex, that have really actually been effective in communicating about COVID-19, whether to the general public or to inform policymaking.
I think from my side, special interest has actually been around the testing data. For us, as I mentioned before, there's the National Health Lab Service System that's there, but I think one of the main problems that we've been having on our side is actually accessing that data. That data, we are given numbers in terms of daily tests and also the accumulative numbers. But what we have been crying even on the social pages for the Department of Health is that we need to actually have a look at that data and go at least deeper below the provincial level numbers that they are actually feeding us. So it's been so difficult. I think there's been quite a few individuals who from time to time get access to that data and are able to share some visualizations that they have. So my interest would be a lot around the number of COVID tests that are done per confirmed cases that are being seen. But for now, specifically, haven't been playing around with any specific charts, but it would be really interesting to delve deeper into the data around the tests.
Well, it sounds like you have really rich data in terms of what's being collected. So I'm curious to kind of follow what the South African story looks like. I know whenever someone talks to me about travel and wanting to get back to travel and they say, where's the place that you most want to get on a plane and go back to? South Africa is always the first place I name. I mean, I genuinely feel like you guys have every different kind of thing that someone could enjoy on a trip there. And I have so many fond memories of working with the JSI office there and would love to get on a plane and see everybody again and get to travel around again. So let's hope that eventually at some point, all of those air travel restrictions loosen up and we can all connect together again in person.
Oh, definitely hope so. I also miss getting out of the house, moving around the provinces and doing my work, but it would be definitely nice to see you again and then hook up around visualizations, but yeah, definitely.
Well, Yaza, it's been great talking to you today, hearing about the lessons and what's happening in South Africa, hearing about the ways in which lessons from past responses to other diseases are really informing the current strategy. And we'll hopefully stay in touch and get to hear updates on how things go. Thank you again for your time today.
Thank you, Amanda.